This case illustrates the use of the vertebral shaped vein selector to overcome difficult CS anatomy. This patient has an existing LV lead, chronic LV lead with high thresholds, and the attempt is being made, an initial attempt to replace that lead, and the implanting physician is able to locate the CS and get wires in, but can't get anything beyond the os of the CS despite trying a variety of different readily available catheters. On the second attempt, we utilized the contrast injection system, attached it to the braided core of the Worley sheath, and utilized the braided core of the Worley sheath to locate the os of the CS. Positioning, once the braided core was positioned at the os of the CS, we advanced the glide wire through the hemostatic valve deep into the coronary sinus, and you want to make sure it's in the CS and not through the vena marshal. And then from there we advance a vertebral vein selector deep into the CS, and then using the vein selector as a conduit, the glide wire was replaced with an 0.35-inch J-tip Amplatz Extra stiff wire. You need to be careful not to use the Boston Amplatz wire because the tip section is very floppy. So from here, we're able to first advance the braided core and then follow the braided core with a Worley sheath over the vein selector stabilized by the Amplatz wire. And then you can see here's our initial venogram. We ultimately used a snare technique for lead placement. The equipment that we used to successfully implant the lead is shown here. And includes the standard curve Worley sheath, the vertebral vein selector, the contrast injection system, and then the Cook Amplatz wire, and not the Boston J-tip Amplatz wire, because, as I mentioned, the J-tip Boston wire has a floppy section that's actually counterproductive.